Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So I'm actually excited to talk about this, and I actually did a podcast similar to this about 3 years ago. Yes, we've been around almost 7 years now. And I just thought it's time to revisit it because I get questions about, should I be a biller, should I be a coder, and where do I get my certification, and just questions like that quite a bit from listeners and new members to my membership and things like that. So I thought it was a good time to just really address or talk about what is the career path in billing and or coding. So medical billing and coding, it does cover a lot of ground. It starts with patient registration, securing claim reimbursement, and hopefully ending with delivery of payment to the provider on both sides. But getting from start to finish, you really have to collaborate as a biller and a coder. You have to collaborate or at least work with insurance companies, patients, and other, numerous healthcare staff, including your medical records staff. So billers and coders tend to work, or hopefully work in tandem to facilitate the healthcare revenue cycle. That's why, back in the day, and again, this is my 40th year in healthcare, we used to just call it the billing office, or, we didn't really have coders. And so everybody was both. But now it's kind of morphed into what they call the revenue cycle management team. And people commonly refer to medical billing and coding really as a single discipline. But I would like you to look at both from both sides of it and then decide, are you a biller, a coder, or are you both? But when considering medical billing and coding as a career path, or I should say, you really need to understand that these are two different jobs requiring different skills and different personality traits. And only you know if it's something that you can really do. So you have to develop enough experience and you can become a billing and coding specialist. But many students as well, they either pursue billing or coding. I personally like both. That's why I always consider myself a coder first, then a biller, then an auditor, and now compliance expert, and actually throw in the assessments right now when it comes to prior authorization. But here are the biggest reasons to consider medical billing and coding as two separate jobs. First of all, the work isn't the same, and I'll elaborate in a little bit. Personality does matter. Interaction with patients, that's huge for both a biller and possibly a coder. Larger healthcare facilities, they do split duties versus the single provider or a small physician practice. Alliance versus autonomy, and I'll talk about that. There are different education and certification requirements, and there's also differences in salary and job outlook. So first, let's look at the work. So when I say the work isn't the same, medical coders and billers have different responsibilities. You have different distinct skill sets and abilities. And let's just kind of break it down. So medical coders, first you have to interpret the care provided for patients into codes a computer system can understand. So there's CPT, which is the procedural terminology code. And then there's ICD-10, which is the International Classification of Diseases 10th revision. And assigning the correct codes and procedure codes requires knowledge of medical terminology and also adherence to CPT coding guidelines and standards. So we also have the general guidelines for the ICD-10 services. Now, billers, on the other hand, they use the instructions provided by the coders to file insurance claims and payer policies, and sometimes they also are the payment posters to the patient accounts. So for claims to be paid, the medical information has to be accurate. Medical billers work with insurance companies to work out certain denials and rejections, finalize details, send out statements, and also kind of in the umbrella of medical billers, many practices put the prior authorization staff in there as well. Then we get into what I called personality matters. So jobs in billing or coding require unique personality types. If you self-identify as more extroverted or introverted, you may be better off leaning one hard way or the other. Let me kind of recommend what I see with a lot of people. So if you are extroverted, you may prefer a job in medical billing because you need to be comfortable on the phone, talking with patients, insurance companies, physicians, providers, and be able to clearly communicate with many different people and smoothly resolve issues when needed. Also in the billing department are collections as well. If you're introverted, so you're just basically someone who likes to work independently, I don't want to say work alone, but you may be more comfortable in medical coding because you often do your day-to-day work in your own occasional work on your own and in your occasional collaboration with other healthcare staff, usually if you have a question on something. But this is typically a better fit or option for an analytically detailed-oriented person with that isn't really easy or feels uneasy with talking to people all day long. It's not a strict rule. Plenty of new people to coding, even people who've been doing coding and billing for 10 years, they now have figured out, well, either I'm introverted or extroverted, and here's where I want to be. And there's a lot of people who tend to be introverted that can also excel in medical billing because of your attention to detail, and vice versa for medical coding. But that's just what I see from an extrovert versus an introvert. Now, billers, this is working with patients. Billers work with patients, coders typically don't. I'm not saying they don't at all, but they usually don't. So working with patients in a clinical setting isn't for everyone. Luckily, there are many jobs in healthcare, including medical coding, where you can really help patients without having to work with them directly. Medical coders typically work behind the scenes in collaboration with physicians, billers, and administration staff. Medical billers, on the other hand, they have to communicate with patients. If then things don't always go smoothly, as they know, and it's a biller's job to act professionally and empathize with patients who aren't always thrilled to discuss costs associated with their medical bills that they never may be expected to have to cover. So effective billers help patients understand their charges, what their plans pay versus what their share of cost is, and they're really an integral part of the overall healthcare experience. So the next time you hear that the pharmaceutical company is bringing in lunch for the staff and the coders always get invited, somebody may want to point out the billers should be invited to that too. I always see them being left out of things like that. Now, talking about larger healthcare facilities, why did they split duties? Well, because they have more staff. So with greater demand for billing and coding services in larger organizations, hospitals especially, they often employ specialized coders and billers to carry out their individual responsibilities. When seeking your first entry job level in medical billing and coding, a lot of people do start their search in hospitals and other large healthcare facilities because there's more jobs available and more individual jobs. They don't combine them. But in smaller businesses, such as private practices or physicians' offices, it's more likely to find individuals who do routinely perform both medical billing and coding, not just to streamline the process, but to limit operating expenses as well. And it depends on what type of role you want to look to, if you want both, or you're just looking for, to get your feet wet in it and then build from there. And where do you want to continue developing your professional experience? Is it in coding and billing or in both? Also for me, as much as I enjoy being a coder, and, obviously I've branched out from, for the last 20 years in auditing and now in compliance, and et cetera. One of the things I really liked about coding and billing is actually being able to say I was both, because I want to see that what I code also gets paid. And a lot of times coders don't get to see that. So you also have to decide if you want to be on the professional side, physician services, or if you just want to be on the facility side. Now, can you be both? You can, but it's rare to find somebody who does both. And then I mentioned alliance versus autonomy. So medical coding is an alliance role and medical billing is an autonomous role. So what that means is that medical coders typically work directly for healthcare organizations in alliance with physicians, administrators, and again, other healthcare workers. But medical billers, they may potentially work, more autonomously. They facilitate communication between several parties necessary to make the interfacing, integration, the billing process, all that to work together. So billing may be the best starting point for someone who maybe is an entrepreneurial-minded individual interested in climbing the ladder in the healthcare administration field, because it's easier to show a track record. Now, education and certification requirements, that's a big one. So they're very similar to both billers and coders, meaning you have to have some kind of credential nowadays. And many employers prefer applicants with a diploma or associate degree, either in billing, coding, or both. But there are different industry certifications for each career. So you have the National Healthcare Association, the NHA, You've got the National Billing Association, and you can be certified. There's a certified billing and coding specialist, CBCS, and so there's all kinds of different certifications for billers as well. Now, when it comes to certified coding associate, certified coding specialist, physician-based, certified coding specialist, facility-based, there's also the CPC, Certified Professional Coder. Those come from typically the two largest bodies, which would be AHIMA and AAPC. And so those are the desired certifications for medical coders. There's others. I'm sure many of you have seen the alphabet soup after my name. So there's QPro. There is the Medical Association of Medical Billers. There's all kinds of different things where you can get different credentials. There's the Prior Authorization Coding Specialist Association. So there's all kinds of things where you can look at, all kinds of bodies, I should say, credentialing bodies. There's NAMIS, which also certifies auditors. So you might want to take a look at all those different areas and who's requesting what. Now let's talk a little bit about salary and job outlook, because they can vary. So even though the two jobs are closely related and have similar education requirements because they are fundamentally separate between medical billers and coders, there are different average salaries. And this may not seem fair, but this is what I'm seeing. So the Bureau of Labor Statistics reports billing and posting clerks, including medical billers, they're earning an average right now of about $47,000 a year. That's about $23 an hour. So as far as employment from 2022 to 2032, the BLS, again, Bureau of Labor Statistics, they they anticipate an increase in employment in the next 10 years. Now it's 8 years, of about 4%. And then there is the medical records technicians, which actually they include medical coders there, which I think is interesting. And they earn an average salary, which is a little bit higher, of $52,310 a year, and that's about $26 an hour. And they project that the increase in employment from, again, the next 8 years is about 9%. So, and now with AI, those numbers could change, but that's what the Bureau of Labor Statistics says. And also, the further the more you further your education, develop skills, and gain experience in the field, of course, the better chance you have to earn higher pay, qualify for better jobs in this field, and you could potentially advance, in what you're doing. So you want to make sure that you're increasing your earning potential, not just by taking tests and getting credentials, but learning, getting experience, making sure you're attending not just, meetings with those associations, but also attend webinars. Even if you don't think it's a specialty that you're interested in, maybe you could learn something. I wanted to kind of break a rut I felt like I was in last year. And I thought, all this information that I kept reading about, kept seeing that it was a problem, and then there was all kinds of things that were going on with the prior authorizations. And this was actually probably the last couple of years. I'm like, this is something that is affecting not only my clients, my membership clients, but also my physician clients' practices. And it's something that I've had to help them with appeals, etc. And so I finally decided, let's continue to educate myself in that, and then finally got certified as a prior authorization certified specialist. So it's something that you have to keep reaching. And you can't, in your 40th year of healthcare, for me to continue to even want to get another certification, people are like, what are you doing? You already have 14 certifications. Because you can't stop learning in this field. Healthcare is a huge field of learning. One of my favorite things I do is I love to write. I have books on my website, specialty, coding books for gastro, for cardiology, and just making, I think I have one for ortho, but I have different ones, peripheral cardiology, just because I really like putting to paper and making it easy for someone who's just, I don't want to say lost, but maybe challenged in a specialty maybe they want to pick up or they want to learn. And so that's where I think if I was going to give you some advice about being a biller or a coder, I would advise you to be both. You can wear both hats. Those who walk the line between introvert and extrovert, if you get the right education and develop that experience in both roles, you can really be an invaluable employee, and you can be a specialist in both coding and billing. But be reasonable in your expectations from graduating from whether it's an associate degree, whether it's a credentialing program, and most jobs don't require a college degree. I have a college degree only because I also have a nursing background, but I also wasn't planning on being in healthcare. I wanted to be the CEO of Procter & Gamble, believe it or not, but I just chose a different path because while I was going to college in Pennsylvania, I basically worked for a physician. Went there when I was just turning 17, as I started college early. And it was just interesting because all of a sudden I fell in love with coding, fell in love with being in healthcare field. And even though my bachelor's degree is in economics, I have a secondary degree in healthcare and so in nursing. And so that's where sometimes just being in the field, you can be like, I really love this. And so you might be, if you're new and you're listening to the podcast, you might find an entry-level work from home position because so many jobs now are remote. You may find that possibly straight out of school or straight out of there, or straight out of, your credential. If you've been doing this for a long time, you still might need to work your way into the job you really want. But if you continue to make sure that you really increase not just your knowledge, but what you're willing to do, information you're willing to write about and just to understand, attending conferences and things like that, and really encourage your employer, if you're working and not just an entrepreneur, encourage your employer to send you to these things. Say, you know what, information changes, it's fluid. We need to be updated every year, and one of the ways to do that is to also make sure that they're giving you opportunities to network, to find out what other people's plights are when it comes to healthcare. And let's face it, we're in an election year, and right now they're taking all kinds of different healthcare policies and making it very political. And it's going to be up to you to know, okay, what are they doing with supervision? What are they doing with Incident 2? Where is telehealth going from a permanency level? We're getting new codes in 2025 on telehealth. So things like that, it's going to be really up to you to understand what the next step is. And there's never going to not be a job in healthcare. So always keep that in mind. You can be a facilitator of so many different things. The Codecast podcast is also brought to you by Decision Health. Join Decision Health this November for the Advanced Specialty Coding Virtual Summits. Dive into orthopedics, pain management, and anesthesia specialties and get the latest guidance for accurate coding, billing, and compliance. Visit codingbooks.com/events to register. Save $50 with coupon code ASC2024. So I hope today that was kind of some insight that maybe was helpful to you. I know I get these questions all the time about being a coder and a biller and really where to start. Even for those of you that are having a struggle finding a job, your perfect job, start in medical records. Start somewhere where you can build and show what you can do, show what you retain, and you'd be surprised what will make a difference to an employer. On a personal note, I wanted to make a correction on, I was sharing some shows that I watched. I mentioned the Bosch Legacy, and thank you, Sarah, for sending me the email. She said I mentioned it was Michael Crichton, and it was actually Michael Connolly is the author of those. And so if you get a chance, just, take a look at some of those streaming shows. You never know what you want to kind of bury yourself in. Also, if you get a chance, it's now June. Get outside, smell the roses, look at the trees, get some fresh air in you, and just, try to get some outside nature. I'd go for a walk, anything. I'm in my pool every day. Been in there every day now for the last 46 days. Yes, I'm counting just because I like to think I'm getting really tan, but I think I'm just one big freckle. I am Irish, but you can probably see if I also do the live podcast with the compliance guy on the roundtable. We're there about twice a month on Mondays, and then also the hashtag Terry Tuesday with Sean Weiss. That's various Tuesdays that we also come up with a one topic podcast. So I'm everywhere. I'm going to be starting with my Steel City Underground weekly podcast for What the Football, the WTF, coming up here probably when we start preseason in August. And so just keep an eye out for a lot of those different podcasts. I also have one that I'm going to reboot. I haven't done it in a long time. And this one is about entrepreneurship in the healthcare field. And so it's called The Business Collective. And it's been probably a year and a half since I've really done a podcast on that. And I'm going to make an effort to kind of bring that back to life since I have some time. So everyone, make it a great day. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.